Hello, it's Al Trucker here. I'm doing a quick presentation about World Obesity Day. World Obesity Day is March 4th of 2024. And I'm going to cover a couple of topics here. And I'm going to use some materials that are on the Obesity Canada website, which are their materials. It's an organization that I like to work with and am very privileged to work with, is they help me tell my story, and they also help change the narrative on obesity in a way that's positive for people living with obesity, as well as medical professionals and family members that are trying to support them. And I am certainly one of those people. So I'm going to put this up here. I think I have knocked my microphone over. I hope that that isn't terrible. Um, so there's my banner there, right? Chatting about life with obesity, but I'm gonna specifically go into something that came up in a conversation I had recently, in a quick exchange, and I want to point out that it's important for me to say that I do not want to tell other people how to feel about a condition they may or may not have, and I do not want to tell people that they need to have a label or that they need to accept the words that we use, not the ones that I use personally or the ones that are used by Obesity Canada. It happens to be an organization that is very supportive of people living with obesity in this country. I am Canadian, and so it is an organization that is local to me. And it is an organization that's done some amazing work and continues to do so. And I want to support them, and I want to have other people be aware of them. And I believe I'll be hard at work on March the 4th, which I believe is Monday. And so I will not be able to do much other than listen to the presentations that they will be making. On World Obesity Day, Obesity Canada will be doing some live sort of streams on the web, and I will find those links and share them below my video when I post it. I may do a premiere of it and then make it available for people to see this weekend, and I will continue to promote it or maybe bump it up in the system on Monday so that people can see it, because it will be topical. I'll quickly introduce myself for people that don't already know me and my story. I am a person who grew up at my early childhood. I was a fairly normal sized person. As I entered puberty, I became more and more of a large bodied person. And I believe I fit the category of being obese or living with obesity by the time I was in my late teens, because it was affecting my health and well being at that point. My BMI would have been in what we used to use as like strictly BMI. I would have been in the obese category from my early teens onwards. Um, I certainly experienced a fair bit of typical schoolyard teasing, and that sort of thing. I think most people that live with obesity or being overweight, living with an overweight condition, have experienced that, especially if it happened to them in their childhood. It's an unfortunate part of growing up, and this is not something that for me was um, a great experience. However, it did teach me how to deal with things in a way that may or may not be entirely, um, I don't want to say entirely helpful, but life is full of challenges, and I'm not gonna pretend that it isn't helpful to have dealt with some in my early years. As I became an adult, I I went through my 20s and 30s living in relatively decent health. The problems that I've had have largely um, manifested in my 40s, which is where I am now. But within the last decade, I've had some health challenges and experiences that were extremely um, difficult and painful, and they were not made better by the attitudes of people that I dealt with in the medical community. And when I think back, I can actually say that many of the interactions that I had in my earlier life, in retrospect, were neither kind, helpful, or supportive. And I can also think of many experiences that my wife and I had together dealing with her health and well being and that of our young children, while giving. My wife gave birth to both of our children, and the care that we received before, during, and after as for our family hasn't always been good in that regard either. And I will not um, go into further details on that because I don't want to speak for my wife nor share her story without her permission. And I don't think she's wanting to do that. But I will say that um, having experienced it alongside her, my side of it is that I was very upset with things that were said and done and the way things were presented to us. Now, I'm going to go into um, this discussion in this presentation that I'm making, saying that people that live with obesity are human beings. We're real people. We should be displayed with our faces, with our permission. One thing that we talk about and complain about is when we're shown on television, for instance, or on some sort of a presentation. I think nowadays TV has given away largely to um, computer-based and phone-based media. Social media programs and stuff are not a whole lot different. They'll often present things about people living with obesity where our faces are cut off. We're not shown as people. Our bodies are shown. I suspect some people would say that's so that we're not shamed. And the presumption that we're ashamed of being ourselves is a difficult one. And some of us are ashamed. And I have felt that shame personally. I'm just having a sip of water here. I've been fighting off a very mild cold. It seems to be affecting my voice and giving me a dry throat. So I'm gonna continue with my presentation here in a moment. Um, I'm just gonna check to make sure that what I'm presenting is what I want to present here. This is from Obesity Canada here. Yeah, this is great. Okay. So I'm gonna go back here and I'm gonna present this, add this to the stage. Here we go. So this isn't really the way I want to present it. Remove from stage. I'm trying to do this. I think stop this one. I want to add. I want to present. Sharing screen. This is what I want to do. This. No. Okay, here we go. Entire screen. No. There we go. Allow. Okay. So is this one I'm sharing? I'm not sure that it is. I'm a little confused about what it's going to show here. I think if I do that and then do this, there we go. Okay. So here it is. So this is how obesity is measured. So there we go. So I think I got to do this again and then go this. Yes. Okay. So here's what I want to show us here. So how obesity is measured is an important thing to think about. And Obesity Canada has done some great work putting this together. So what they have here is what causes obesity and how we how we see it. So, um, obesity is a disease, and I'm gonna just go through this, and then I'm gonna talk about how it's measured. And the reason why is because this came up to me when someone said they did not want to be labeled as obese or living with obesity and have it as a disease. They wanted to call themselves fat, and they wanted to say that they were fat, and they did not want a disease um, label attached to it. And I think that's fair. That person is welcome to that opinion. They're welcome to think and understand that. I think it's nobody's opinion about themselves, their own body, and their own conditions or lack of conditions is wrong. And I also want to say that there should be, when it comes to body positivity, people should be positive about their bodies and not feel terrible about the body they live in. I would far rather that not be the case. Um, I feel that that type of attitude is prevalent and wrong. So obesity is a disease of the brain. That's a question mark there. It's time to stop shaming and blaming people for their weight and start treating obesity for the chronic relapsing disease science says it is. It's a chronic disease characterized by the accumulation of excess body fat that have a negative impact on our physical, mental, and metabolic health, as well as our overall quality of life. And science has made important advances in understanding what's happening in the body when it comes to weight gain, who's susceptible to it. Weight has more to do with genetics and what we are exposed to in the womb than individual choices about exercise or food. And I certainly experienced that myself. Not everybody's experienced it the same way, but there are a lot of parallels that I find when I speak to other people who are living with obesity. And as I've come to share my experience, I've been very privileged to hear the stories of others when I work with Obesity Canada. I've been very privileged to have people open up to me and reach out to me online with the work I've done on social media talking about it. And I will not discuss anybody's individual situation. Nobody has given me permission to say that. I will just say that some of the wonderful people I've met also live with obesity, and they've let me know that. And I appreciate that they are there living their lives with this disease. Um, so here we go. It's a brain related disorder. The hypothalamus regulates energy intake and expenditure to maintain weight, but its normal function can be disrupted by biological and environmental factors. And once disrupted, our feelings of hunger and fullness, satiety, can be affected. And we we get a lot of messages in our minds. And I'm going to go on my own little tangent here in a second here, but look at the things that are here. We got developmental, biological, medical, social deprivation, and inequalities, infrastructure, food and activity, economic, psychosocial, and media influences here on our brain. And I want to talk about this one here: social deprivation and inequalities. People that live with obesity, people that live in larger bodies, we're often not included. And that's something that we'll go back to for many people that have an onset of living in a larger body in childhood will be excluded from many things. Will be excluded from social activities. Will be excluded from sports. Will be excluded from other clubs. And we are often assumed to be or presumed to be less intelligent, less health conscious. We are presumed to be deficient and lacking and somehow wrong. I have often described myself as a mutant in my self-describing of myself, which I'm trying not to do. I'm trying to develop a positive view of myself and of my body, which is very difficult to do when my body, in fact, I saw this today. Someone else doing a social media presentation has as their thumbnail in order to make another person who has a very difficult personality and who may or may not have mental problems, definitely is a very toxic person in their current state. In order to put them down and make them look bad. This person was being portrayed using some AI art, using a body shape, which may or may not be that person's body shape because I've never seen them. But in order to add to what a terrible person they are, and to help drive that point home and to make fun of them, they are portrayed with a body shape similar to the one I actually have. And I do find that to be hurtful and offensive, but I realize that I'm the buttercup that's got to suck it up. So I will do that. That is fine. But this social deprivation and inequality is something that's experienced by people that live with obesity all the time. The trope, I guess might be the word for it, of our body shape and our body size and what that means about us, how it's used to portray us is not cool, in my opinion. So I'm not sure if this is working the way I want it to, but here we go. I feel like this isn't working the way I want it to, but I'm going to stop that and see if there's another way to present here. Share the screen. Okay. Share the screen. Select window or screen. Is it this one? This is really not what I want to do. Entire screen. Not now. Okay. All right. It's not working the way I want it to. But I do want to add this. Sharing the screen. It's just not doing what I want it to do. Share screen. Here it is. Allow. Okay. Anyway, I guess this is it. This is not what I want to do. Okay. All right. I'm got my recording going again. I'm gonna have to really edit this a bit to get it the way I want it to look. What I'm gonna keep talking about here is how life is extremely difficult when your mind is filled with negative thoughts, and how dealing with the physical reality of living in a larger body can be met with not just negativity from people outside, but also people inside. That's something that is hard to describe, is when somebody's words have made it inside your brain and they repeat inside your brain. That can add to a very unfortunate cycle of negative talk. And I think most people are familiar with that. I don't think I'm saying something new or different than what people are familiar with. I believe many of the people that I have discussions with have had negative interactions with other people online and in their real lives. And in real life, sometimes it's extra galling. Sometimes it's expected, sometimes it's not. It depends on who you're dealing with. And we toss out platitudes often about how it says more about the person making the unkind comment than about the person being commented about. And sure it does. In retrospect, sometimes people that are saying the worst things are dealing with some of the worst things themselves. And it may be, in fact, a comment about how they feel about themselves. But putting people down generally isn't a good thing to do. And I do realize, and I've mentioned many times before, that I'm I'm guilty of doing this. I sometimes look at people whose behavior is abhorrent, people whose viewpoints I find disgusting and difficult to handle. That's not something I'm particularly proud of. And yet, at the same time, I'm very proud of some of the things I've come up with to skewer them. And there are people who I feel very unkindly towards because they are so unkind to the world around them. And I don't feel that they're honest, decent people. I don't feel like they're doing their best to be a good person. I feel like they're doing their best to make other people feel like crap, to emotionally blackmail them, and to extract cash donations from them to further their agenda, which seems to be largely self-serving and is often wrapped up in a concept of doing something for a god or gods that people do or don't believe in. And I definitely have taken the piss out of some of those people. I'll probably do it again. I probably won't be kind to people that I view as being deliberately deceptive and hurtful. But I will try to do better. So I'm going to continue on with this conversation. I'm going to say that when it comes to obesity being a disease, I want people to understand. I want people to understand that when obesity becomes something that affects your day-to-day life, like it can affect your mobility, it can affect your strength, it can affect your level of tiredness, it can cause other comorbidities. When it gets to that point, there starts to become no question that obesity is not just a disease, but often a collection of metabolic derangement. And metabolic syndrome is a word that sometimes gets tossed out there. I don't think it's a bad description of what happens because that tends to be a collection of commonly associated conditions. And many of the people that I talk to have issues with joint pain and mobility. They have issues with being able to properly look after their personal hygiene in some cases. And that's something that I've heard people make fun of. And it's not a funny situation. I injured my arm a few years ago and needed some assistance to make sure that I could clean my entire body properly because I was down an arm. Learning how to work with just one arm was difficult. It's not something that's made better by being in a larger body. There are other things that that are important to think about when it comes to having a larger body. But being able to keep yourself clean and well is important. And for people that have difficulty with that, and I have had short-term difficulty with it, I understand that struggle. There are ways to help handle it, but it is not something that anyone wants to deal with. And I find it abhorrent when people make fun of that. I find it abhorrent when people make fun of the shape and size of body that I live in and that many other people live in. It's hurtful in the extreme. And I want people to understand that the words don't hurt if you let them roll off you like a duck with the water on their back. I get that. But let's be serious. Some of those words stick in there. They don't go away. That makes our lives harder than they need to be. And then we get to a point where we've gone to see our doctor and we're trying to get assistance with something. We're in a tremendous amount of pain. And so many of us can tell the story. Well, just lose weight. That'll make the pain go away. There's more than one story like this where someone's showing up. They live in a large body. They have a genuine concern. They have a pain in their body they've never had before. And they're instructed to just go lose weight. Instructing people to go lose weight isn't instructing anything. I think I would be extremely hard pressed to search the world and find someone who lives in a large body who hasn't tried to shrink it, who hasn't been told over and over again that their body is wrong, that they shouldn't be that way, and that they chose to be that way, that they did it to themselves. And then that person has done, as in my case, dozens of times, attempted to lose that excess adipose tissue in order to fit into society, in order to fit into chairs, in order to fit into the world we live in. And so I'd like to invite people to think about that for a minute. Is that really helpful? To just say, go lose weight, and the problem will go away. Especially when what's really wrong is the person has cancer and they're dying of it. And then they finally do look, and it turns out, oh yeah, they do have cancer. But it's too late to treat. We ignored it when it first came up. When it wasn't too late to treat, we just thought you were a fat person who needed to get out of our office and leave us alone. Well, that's actually happened. That's fucking disgusting. I'm not okay with that. And so I'm gonna talk about some things here. As you live your life in a normal body, if you happen to be that kind of person, you may not realize that it's difficult for someone in a larger body to climb a set of stairs. You may not realize that it's hard to climb a ladder. You may not realize that we might fall down more often than other people because our bodies aren't as balanced. It still hurts. Some of us can break bones. Some of us have broken bones and been told that the pain we have is just from being overweight. We just need to go lose that weight. Interestingly, people in bariatric medicine have figured out that in many cases, those of us that live in a body this large need surgical intervention or medical intervention with the help of pharmaceuticals. And just doing eat less, move more doesn't solve it. I've tried that many, many times. I have eaten less, I have moved more. I have lost weight, I have gained weight. I have lost weight, I have gained weight. I've lost and gained weight many, many times. There's something different about the way my body deals with calories, the way it stores them, the way it plans for days that never come when there's nothing to eat. And my body is getting ready constantly. And despite having lost over 70 pounds over the past, it's coming on a couple of years now, and I've been able to sit at a pretty even weight, and I consider that a win. Other people would be just absolutely, they'd be just, it's a disaster to be at my weight. My weight is far too high of a weight for a person to be at, but it's better than being at the weight I used to be at. and maintaining that, not gaining weight again, that's actually pretty good for me. I'm pretty happy with that. I'm planning to get surgery to help lose more. I'm hoping I can lose more on my own before that as well. But this isn't an easy process. So obesity isn't just having a BMI of a certain number. And my BMI is very high. I qualify as a person living with obesity simply on the number. But it's more than that. It's also importantly these other things. Right? I'm gonna try to figure out how to share this here. I think it was here. Here we go. It's here now. Okay. All right, I'm gonna go here. So I'm gonna do this, and no, that's not what I want. No, I want this. Here we go. So I'm gonna read some of this here. Maybe I'll just do it like this, and I'll go here and I'll read this. So there's some great stuff going on here, and they have about education here. I have to accept this. This is about the learning programs. And this is, I'm trying to find the questions here. Blog, this isn't it. Resources. Here we go. I'm going to talk about this. Weight bias, stigma, and discrimination. There's some great videos here. So, it's time to end the socially acceptable prejudice. Canadians living with obesity face widespread weight bias and weight-based discrimination from strangers, educators, employers, health professionals, media, and even friends and family. And weight bias refers to negative attitudes and views about obesity and people with obesity. Experiencing weight bias can have negative consequences for individuals, including feelings of shame and blame, anxiety, depression, poor self-esteem, and body dissatisfaction. It can lead to unhealthy weight control practices. Weight stigma refers to social stereotypes and misconceptions about obesity. These social stereotypes and misconceptions include beliefs that people with obesity are lazy, awkward, sloppy, non-compliant, unintelligent, unsuccessful, and lacking self-discipline or self-control. If you've ever been the victim of weight discrimination, you are not alone. Read on to learn more about what it is and how it can affect you and the steps you can take to eliminate this issue. What causes weight bias and discrimination? These are all these words I'm reading are from the Obesity Canada website on weight bias. Weight bias and stigma can lead to weight discrimination. This is when we enact our personal biases and social stereotypes about obesity and treat people with obesity unfairly. The unfair treatment that people with obesity face is called obesity stigmatization or weight discrimination. And then they have here in quotes, look what he's done to himself. If only he had some self-control or wasn't so lazy. Yeah, the idea we've done it to ourselves, right? I've even heard people that have been very successful losing weight blame themselves, and then congratulate themselves for losing it, and then blame themselves again when they regain. I've done that a bunch of times. Obesity is a medical condition that can be caused by multiple factors, or people often think that individuals living with obesity are personally responsible for their weight because they just eat too much or do not exercise enough. This belief is a fundamental driver of weight bias, stigma, and discrimination. Stigmatization and discrimination can be seen in verbal and emotional discrimination when individuals are teased, insulted, made fun of, or rejected by their friends, family, and peers. For example, weight-based bullying in schools and employment settings. Physical discrimination when individuals are assaulted or harassed because of their weight. And barriers in day-to-day life. Undersized chairs in public locations. Lack of appropriate sized medical equipment such as blood pressure cuffs and patient gowns. They don't have access to health care when treatments for obesity are not available or not reimbursed by health plans. And they have in here, in quotation marks again, maybe she exercised more, she wouldn't look like that. Yeah, I've heard that before. Looking at other people, looking at me, looking at people that I love and know. What are the consequences of weight discrimination? Weight discrimination can affect individuals' access to education, employment, and medical care, causing health and social inequalities. Stigma and weight discrimination is an added burden to individuals' health, can be a barrier to weight management. And they have a check your attitudes checklist. I'm going to click on this. I don't know what I'm going to find because I haven't looked at this part of the page, but let's check it out. Checking your attitude. Here we go. I've made it a little bit bigger here. Do you assume a person's health characteristics, behaviors, and abilities on their body size, weight, and shape? Yes or no? Do you think that everyone with a larger body size or higher BMI has obesity and needs to lose weight? Yes or no? Do you believe people with obesity are personally responsible for their condition? Yes or no? Do you let negative comments about somebody who has a larger body size or has obesity go unchallenged? And do you avoid being around people you think have obesity? Now, um, this this was written by Dr. Mary Foran, a PhD, assistant professor, Department of Occupational Therapy, a faculty of rehabilitation medicine at the University of Alberta. And Ximena Ramos Salas is a public health doctoral candidate at University of Alberta, managing director of Canadian Obesity Network. So, I've met both of the authors of this thing here. This little bit of checking this out, and I've spoken with Dr. Mary Forehand a few times, and she's a lovely person who has some great insights on things. I just want people to think about this. Whether you live with obesity yourself or not, is this something that describes you? It might be, or it might not be. I'm not sure. Anyway, I really think that's worth looking at. It's something that's on the website. You can click on it. You can answer these questions. There's a bunch of videos here. I'm not going to play them. I do hope that people will check that out. World Obesity Day was on March the 4th in 2022 as well. It's on March the 4th every year. That's an easy way to remember it. Anyway, that's that part of this. I'm going to go back to resources here. There's here accessing treatment, reporting weight bias, web information checklist, weight program checklist, sharing your story, the image bank, people first language, obesity and COVID. We got all sorts of great stuff here. International coalition. There's all these great things. These conversation cards. Pediatric weight management, obesity management. There's 5 A's. Obesity care finder. That's a great thing. We got all these great things here. I think it's going to get even better. There's some events here that come up, right? This obesity, Canada, hypertension, Canada, precise solutions. There's some presentations going to be made there. I believe I'm going to be dropping by there. Here we go. I do want to let people know also about OC Connect. There's an online community. You can join that. There's connected conversations, and they do have a YouTube channel where you can often see things. And then World Obesity Day, Obesity Canada will be doing presentations, and you can sign up to see them. I was hoping I could easily find that under events. This is where I am here. I'm not sure if that's here connected. That's not the one. Oh, here it is. This is it. This is the one right here. This is the one. So you can register for free for World Obesity Day. You just type in Obesity Canada, and you can go to this. You can sign up, and there's subtopics here. And there's managing obesity, measuring obesity, behavioral factors, diet and healthy eating, emotional health, physical activity, prescription medications, bariatric surgery, childhood obesity, and healthy pregnancy weight. And so this is going to start at 11 a.m. Eastern time, and it will continue on to 5 p.m. Eastern. I am hoping to be listening in with some of this. Topics, here we go. Obesity is not a behavior. That'll be a lived experience. And I think that's great. I'm sure there's going to be some great people that I've met speaking here, and probably some people I've never met speaking, and I'm looking forward to this. If obesity is a disease, why can't I get help? Issues in living with obesity, what we need to counter them. Make yourself heard, the power of self-talk, a focus on mental health and obesity. Eliciting support, this is part B, from people in your life. And part C, how to talk about obesity with your doctors, what questions to ask, and how to be your own advocate. And part D, advocating for our community. These are things that I have just intersected with many times in my life, and I've started to change my behavior. I'll talk about that more in a minute. So, if I can do it, so can you. Successful patient advocate story and a vision of hope. What does a perfect future look like for people living with obesity? How do we get there? This is a discussion panel. That is fantastic. So, there's all these amazing things here. It's going to be happening on March the 4th, which is Monday. There's some people here that are from Connected 2023. You can watch what was said last year. I know a bunch of these people. I've met a bunch of these people. They're wonderful. They almost always get excellent people on to speak. And they have some great team members. Now, I'm just going to look here really at measuring obesity, which is what I started talking about here. This is a BMI chart. And it says here, underweight is under 18.5. Severe obesity is over 40. I'm over 50 in my BMI. Being overweight is 25 to 29. Normal is 18.5 to 24.9. And obesity is 30 to 39.9. And severe obesity, I think we used to use the word morbid obesity. And then waist circumference risk threshold is another thing. So that's something. I also have a very high waist circumference, and that is something that actually is far more important for assessing that someone is living with obesity, as opposed to just being in a different BMI category, because none of these numbers mean anything on their own. And I would still be in the obese category if I had 0% body fat. I've said that before. I'll say it again. And it isn't true of everyone. There are people who are in the normal range who are actually living with many things that are um, coincidental or comorbidities of obesity. And they may, in fact, have a body that's as unhealthy or worse than someone who lives with obesity based on this chart. It's just not a good way to access it. But health is not determined by the amount of body fat alone, but where the fat is located. Well, fat is located in your abdomen. Belly fat is an important risk factor for diabetes, hypertension, heart disease, fatty liver, and other metabolic problems. The fat in your hips and thighs are less associated with health problems. This is why researchers suggest measuring waist circumference to determine obesity-related health risk. In Caucasians, a waist circumference of more than 35 inches in females and more than 40 inches in males suggested in individuals at a higher risk of developing metabolic problems related to obesity. And they specifically put that up probably because there's a large percentage of Caucasians living in Canada, but lots of people from other communities are there. And I know somewhere else on the website, it actually says how to take this for other communities, other people who are genetically related to other areas of the world than I guess Europe, for instance, where many Caucasians would hail from, in terms of like what we associate with racial differences, which I think are pretty minor. In talking with other people that live with obesity from many races, I haven't seen a whole lot of difference. Every one of them believes that they're the one that's from the culture where the food is terrible and contributes to developing obesity. And I haven't found that to be accurate. These are interesting things to look at. Now, bariatric surgery is another thing that's interesting to look at, but another big topic that people talk about a lot is prescription medications. So when I first saw this image here, because I've seen it before, I thought they were holding one of the injection pens, but it's actually just a pen for writing they're holding onto there. But there are some pens that are used for this. So there's a list here about different medications that are available, and I'm gonna sort of read through them here quickly. What's on here? I'm just gonna mention them. I won't get into details, but pharmacotherapy clinical practice guideline is available. There's a link here because this website is meant to help medical professionals and patients alike. There are different parts of it that are aimed at both. And I suggest to people, whether you're a medical professional or you're a patient, or if you happen to be both, because some people are both a doctor and need obesity care, you should read through all of this. Wegovy is a brand name for semaglutide. Semaglutide is also used. The dosing is slightly different, but it's also used for the management of diabetes, which I'm actually on that medication. It's a GLP-1 therapy. GLP-1 is a naturally found. I believe they call it's a hormone. This one is a synthetic version, and it helps neurons in the brain to help you feel more satisfied. We use hunger and control cravings, and it also actually does slow down digestion. Um, so there's in Canada, Wegovy's been approved, by the federal government's drug assessment organization, which I can't think of the name of off the top of my head right now. But in Canada, it's approved to be used with a reduced calorie diet and increased physical activity. So those things are still necessary. They are important, but they're not the whole solution. And so they talk about if you have a smaller BMI, and you're only technically overweight, but you have a comorbidity, so hypertension, type 2 diabetes, dyslipidemia. Those are ways that you could qualify to use this medication, but that does not mean that your drug plan covers it. And in Canada, we have healthcare, but not pharmacare for most people. There's Contrave, which is naltrexone and bupropion. These are medications that are used. So this is a combination of things, right? So they move these together. So there's an atypical antidepressant and something used to manage alcohol and opioid dependency. And they're prescribed sometimes for smoking cessation. These medicines work on two separate areas of the brain and are involved in controlling eating, hunger, and cravings. Contrave is delivered in the form of an oral tablet. The maximum recommended dose, 2 tablets are administered twice daily, so that would be 4 per day. And in Canada, it's approved for use alongside a reduced calorie diet and increased physical activity. So again, you're not going to lose weight just by popping the pill. None of these things will do that, or these the injections. So semaglutide is an injection, although there are some versions of this medicine that could be taken as a pill. Saxenda, also a GLP-1 or glucagon-like peptide one, is used. And then there's orlistat. So Saxenda, which is liraglutide, is very similar to the medication that's mentioned above here is Wegovy. So I can't recall if they're made by two different companies and they're competing, or one's a newer version of the other. I can't recall. These are worth looking at. And Zenecal is another one that you'll hear people talking about, which is orlistat. So Zenecal is for fat from food to be absorbed into the body. They need to be broken down by enzymes called lipases. When Zenecal is taken with meals, it prevents those enzymes from working and causes a decrease in the amount of fat your body absorbs from your food. When you absorb less fat, you take in fewer calories, leading to weight loss. It does not decrease or change your appetite. So that's an important difference here, in that liraglutide and semaglutide that I've had direct experience with do tend to reduce your craving for food, or the hunger signals, which that is a common thing that people have, and it's one that I definitely have to some degree, where my hunger signals are not typical. They're higher than typical, I believe. So I think when I am hungry, I eat more volume of food, and those medicines, when I have been on them, and I'm on Ozempic right now for helping control diabetes, it does seem to reduce my appetite. So Xenical does not decrease or change your appetite. It may improve other health factors beyond weight, including waist circumference, blood sugar, blood pressure, and cholesterol levels. It's administered as a capsule during or just following each main meal. So I'm not sure. I'm not sure about that medication at all. I have never taken it, and I have never taken Contrave either. Although I have been at one point in my life on this other one, bupropion. Bupropion. I think I'm pronouncing it wrong. Anyway, so here I am, looking through some of this stuff, and I just want to bring it to people's attention that there's some great things on here. Um, and Obesity Canada is doing these amazing things here. They're helping health professionals, researchers, trainees, and students, policymakers, and Canadians living with obesity. So it's a Canadian organization, and I just want to point them out because they're doing stuff that's important. So they've got some great information. I really like people to avail themselves of if they need it. And if you're a person who knows people that live with obesity and you love them, you like them, you support them, they're your friends, your family, try to remember that life for them isn't easy. Getting out of bed in the morning isn't always easy. Facing the world isn't always easy. And as an adult, you still experience a fair bit of bullying, combative words from people. It can make it can make your personality inside your brain change. I I know it's done that to me a few times, and I try to bring myself back to where I ought to be because it's not fair that I get upset. Um, I should not be upset with people for having bad opinions. I should not be upset with people for having bad ideas. I should be accepting of the fact that they come from living in our society. But I do feel emotions and I feel hurt and I am able to process what people are saying to me. I'm not quite as stupid as I appear when I'm taking in information. When people say things to me that are intended to be mean or hurtful, um, yeah, I'm fat. I'm not stupid. So I understand what's being said, and it pisses me off. With that being said, I'd like to leave everyone with a final thought that I haven't thought up yet, but I'm coming up with it as we go. And that is that on March the 4th, I'd like everyone to remember that people who live in a large body are not all sick or not necessarily deserving of the biases we often receive. And most importantly, we are often not just not stupid, but we're intelligent and thoughtful human beings, and we are often caring friends and family members of other wonderful people who live in different sized bodies, whether larger or not. And if you know somebody who's struggling with obesity, they live with obesity or they live in a larger body, and they need some resources, I'd like you to recommend to them that they check out Obesity Canada's website. Even if you're not from Canada, you can read anything on there. It's all available. There's some great resources. There's some great videos, and they will be doing a presentation that'll last a big chunk of the day on March the 4th of 2024. I realize this video may be up longer than that. So I want to thank everyone who stopped in to listen to me ramble. I'd like to thank anyone that spends any time checking out the Obesity Canada website. It's one that I think has some great information on it. And and I just want to thank people for joining in. Um, I would like to encourage people to make comments, to like and subscribe, or look and describe, depending on what you prefer. And I also want to thank all the supporters I've had in the community who've encouraged me to keep on saying things. I don't have a huge subscriber base, and I'm not sure that I ever will, but I do appreciate that the people that come out to support me um, continue to do so. And I want to let people know that earlier this week I did post a new song. I am I am being unkind to people that are flat earthers. Um, the nice flat earthers, I don't want you to take offense. I'm having a little bit of fun. The flat earthers who are terrible people, mean people, who are toxic and liars, and are probably actually not even truthful about their beliefs. Um, you are welcome to take as much offense as you're able to from my new song, and for the nicer among you, I'm happy to discuss the topic with you, but it is a pretty silly one. Um, so yes, I I'm encouraging people to be kind, but I'm also encouraging flat earthers to please, please think long and hard about the things that you're hearing people say. The whole world isn't conspiring against you to pretend the world's a different shape than it is. And I'd like everyone to have a wonderful day, both today and on Monday in particular. It's World Obesity Day. And no matter what words you want to use about living in a larger body, about living with obesity, whether it's something that affects your life in a way that is deleterious or not. And if it's not deleterious, you don't have a disease. You're not living with obesity. But if it is affecting your health, if it is something where you have a metabolic syndrome or collection of metabolic diseases, you have trouble maintaining a normal body weight, then you are living with obesity, most likely. You should talk to your doctor. And if your doctor is unable to support you with that, I hope that you have access to a better, different doctor. I've made some great strides in that direction, and I've had some medical issues recently, and they've been treated much better than they have in the past. So things are getting better. That's my final thought. Things are getting better. They're not perfect. I'm not going to stop talking about it. I want to keep getting the message out. It's important that medical professionals be trained in what is true, not what is not true, and that they know that what is true is that their patients, no matter what size body they live in, are human beings who deserve to be treated with respect and great care, and they deserve to be listened to. Thank you.